All right, hello and welcome to Generations of Regeneration, brought to you by Osteoscience Foundation. My name is Jessica Lee, and I'm going to be your host for today. I finished dental school at the inaugural class at Touro College of Dental Medicine, and I completed my residency just a few months ago at Nassau University Medical Center. And now I am at the University of Buffalo with Dr. Markiewicz as a pediatric craniofacial fellow. And so today it is my honor and privilege to be interviewing Dr. Markiewicz today. And he is someone who really does not need any formal introduction. But of course, for formality, I will introduce him just briefly. He is a dual fellowship trained oral and maxillofacial surgeon who is currently the chair of the Department of Oral and Maxillofacial Surgery at the University of Buffalo. And he also has an MPH from Harvard. He completed his 6-year residency at OHSU, followed by a craniofacial fellowship in Orlando with Dr. Ramon Ruiz. And then he later on, immediately after that fellowship, went on to do a head and neck oncology fellowship with Dr. Rui Fernandez at Jacksonville in Florida. He currently also serves as section editor for the Cleft Palate Craniofacial Journal, and also the section editor for the Journal of Oral and Maxillofacial Surgery. He also serves as the vice chair of the education committee for the International Association of Oral and Maxillofacial Surgeons. And if that wasn't enough, he also has published countless publications, and he is an international speaker. He travels so much just to speak to audiences all over the world, and it is truly a pleasure to be able to speak with him today. Dr. Markiewicz, welcome, and thank you again for joining us.
Thanks, Jess, for having me. Good to be on remotely with you right now.
So just as a disclaimer before we start, this is titled Generations of Regeneration, but it's important to mention that Dr. Markiewicz and I are actually in the same generation, but it's just so impressive that he has completed all of these things, and it seems like he would be generations above me. So I just had to mention that he is so far beyond his years in his career, and it's just really quite impressive. So the first question I wanted to ask, really is just around mentorship. And Dr. Markiewicz, one of the things I really noticed about you working with you every day is you speak a lot about your mentors and the people who have influenced you and guided you on your path. And I'm just wondering, if you could share a little bit about who those mentors are, if you can share some of them and how they do or how they did impact and shape, where you are today.
Yeah, thanks, Jess, and thanks for the kind introduction. I guess I have to give you a pay raise after that, so or a bonus. But yeah, I think that's something I'm really passionate about is mentorship, and I think we're all products of who we've been around, whether personally or professionally. And to be honest, I think good mentors in general not only teach you how to be good surgeons and how to do surgery and how to treat patients, but I think the really good ones treat you how to be good people. And so I've had no shortage of good mentorship. In fact, I think I am so proud of that. I can't speak highly enough of the mentorship I've had. And it really started back in dental school. People who I work with in our department now, Dr. Hall, who many don't know, Dr. Rick Hall, Dr. Joe Margarone is someone who introduced me to oral maxillofacial surgery, and to be honest, took a kid who was not that good academically and really got him interested in oral maxillofacial surgery and took me to the operating room and took me to orthognathic cases and so on. And then that continued throughout dental school. And then also after that, really when I spent time in Boston, and it was Tom Dotson, who's now my boss at the journal. He's editor of the Journal of Oral Maxillofacial Surgery. I spent a year with Dr. Dotson and did an MPH there in Boston. And I mean, just if you talk about mentorship from a research perspective, if you've ever published with him or wrote a paper with him, he will go through 7 to 8 iterations of a paper with you. And that's what makes him so good. And so he really taught me about a lot of the things I know about epidemiology, biostatistics, and how to be a good clinical researcher. And then I was really lucky enough to take that knowledge with me into a program to where I think was really pushing research in oral maxillofacial surgery. And, I was so fortunate in Oregon when to me, that was just an incredible residency experience. I started off there with Kevin Arcee, who's a good friend still, a mentor, a colleague now, who's now the chair at Mayo Clinic. But Kevin was my program director, and I mean, would mentor me on papers, how to be a doctor. I saw my first cancer consult with Dr. Arcee, and that's really seen him interact with patients is what got me interested in cancer. Um, Brian Bell, who is like my academic uncle, sometimes I say maybe father, maybe my academic brother, was just so influential in pushing me to push the envelope clinically. And when I first came to him with the idea of doing dual training in pediatrics and also in head, neck, and reconstructive surgery, he was such a big backer of it. And he really sold it from the point of, at the time, Brian was so it in craniomaxillofacial surgery, he sold it from a point of having a unique niche and a practice. And so he helped me set up rotations with Ramon Ruiz in Orlando, Rui Fernandez in Jacksonville as a medical student. And after that, I was debating to do maybe even another specialty, an additional specialty. But after I did that, it was over and I knew what I wanted to do. And that was because of Brian. And also just wrote numerous papers and chapters with him. And he was just so supportive. He's such a gentleman, and I can't say much more about him. And then you add Eric Dirksen to it, who needs no introduction. Eric is a good friend, and now he's retired, but just a master surgeon. And I think goes back to teaching you how to be just a good person. He not only taught me many things about surgery and how to treat patients, how to talk to patients, how to deliver bad news, but also how to apply your skills, and also just really how to be a good person. Um, it goes on. Mark Engelstedt, who I think needs no introduction, just an amazing teacher in the operating room. What I do today in trauma and also with cleft bone grafting, not only from a fellowship perspective, but I do it really a lot how Mark does it. And he's such a methodical teacher. I think he does the right thing. He tries to teach you how to treat patients right. And again, that was my residency. And so, and it goes on. There's so many others, the residents out there, the fellows, Ashish Patel, Alan Chang, who were fellows at the time when I was a fifth and sixth year resident, just learned so much from them. And then I really hit the jackpot that I went to Orlando with Ramon Ruiz, the late great Ramon Ruiz, who those who trained under him and worked with him know how passionate he is about treating children. And that's the thing about Dr. Ruiz, is that he was such an amazing surgeon, technically so gifted, and it was hard to keep up. And even now, I think about how good he was. But to be honest, what I really got from him, and I think all his fellows agree, is his passion for treating children, and also his passion for thinking that our specialty in oral maxillofacial surgery should be the ones or part of the team treating these children. And that's something that I take from him, and I try to pass along to trainees now. Um, and then I always talk about my last year in training was a fellowship with mainly with Rui Fernandez and some others in Jacksonville. And it's a time where you think you're a fellowship trained surgeon, and you went to a decent residency and you learned all that you could know. And I always say my areas of growth, biggest growth, were my intern year, my first year in residency, and my last year with Dr. Fernandez. And I think you think you know everything, but really, Rui is such a master surgeon, and the way he talks to patients, I mean, the way he delivers bad news, I learned so much from him. And to be honest, I try to do just so much of how I operate now, and how I talk to patients is from how I saw him do it. And things like certain books I recommend to patients who are in the palliative care process, that all comes from him. And of course, the bonus is I always tell my mentors is, now you bought me, I get to contact you whenever I want for advice. So I do that often, and I do, and I contact for tough patients. I contact all these people, but then also I'd like to say, and I don't want to go on too much about this, but you develop mentorship throughout life. And my first job with Michael Maloro, Michael taught me how to do nerve repair, how to be passionate about it, how to evolve that. He's taught me how to be a leader, a chair. He's taught me academically how to do things. Brian Farrell, who I text all the time questions about orthodontic surgery. Marco Caminiti, the same thing. I will hammer them about questions about tough cases or how they would do things. Sean Edwards, who I met when I was a interviewee at Michigan, and he was just a first year program director. Sean is someone who I probably have kind of modeled my career after, being a pediatric kind of reconstructive surgeon. And then, of course, people locally who, Jessica, Dr. Perry, Dr. Hicks, Dr. Cronin, Dr. Hall, people like that who continue to mentor me. And as I move into a more administrative role the past few years, I think I needed help. So uh, I've been so lucky about that. And those have been some of my mentors. But I think the key thing is we always need help. And no idea is ever original. I think we all think we come up with these ideas that are original. But as someone just recently told me, it was a great quote. They said, if you think you have an original idea, you haven't read enough, or you just don't speak German. So I think it's probably pretty true. And I think we all just redo ideas, and we kind of take from those and maybe make them better. So
Yeah,
that's my,
absolutely.
yeah,
Thank you
that's
for
my take on
sharing.
mentorship. Yeah.
Yeah, no, I mean, and I think that, as your fellow and having the privilege to work with you, it's the coolest thing about it. And probably one of the most, important things with mentorship is when you have good mentors and you become a mentor yourself. You've passed so many things to me that are from all those individuals. I recall you quoting, things from Dr. Fernandez or Dr. Ruiz. And like sometimes you'd be like, oh, well, the way that, Dr. Ruiz used to do it was this way. And then you'll show me how you like to do it. And it's usually a mixture of like something he taught you and something you discovered that you like a little bit better a certain way. And so it's just really awesome to be able to learn from those giants through you, because I won't always have the opportunity to learn from all of those people, but at least, through you, I can learn a little bit about their training and how they taught you. Um, and obviously you're so accomplished, and you've done so much. And so my next question for you is, why do you do what you do, and what drives you? Because I see you work every day, and you're up really early, you're working hard, and you're always working late as well. And that's not something that I think a lot of people have the energy or the motivation for, for so long. It's people think, oh, in residency, I'm going to push and then I'm going to relax. But I know you've, really worked a long time, obviously, with your training, you can tell. So what is that for you, and why do you keep pushing so hard?
Yeah, I think it's ingrained in us a little bit. Especially in oral maxillofacial surgery, it's so rigid. We go from undergrad, try to get into dental school, from dental school to medical school, if you do medical school, to residency, to fellowship, to your first job. And we're always kind of pushing to get to that next thing. And I think it's a great point you bring up, is that there doesn't always have to be the next thing. You can just kind of be happy. Like, I've to be honest, I joke I've been in Buffalo for just about 5 years now. And I'm like, in my head, I'm like, okay, like, I feel like 6 years is the max. I got to move somewhere. And that's not reality, but I think we're just so geared to like the next thing. And so I think what pushes me is, number one, patient care. When I get tired and, oh, I don't want to look at cases, or I don't want to answer emails at night, it's like, well, you have to for your patient care. I think number two is to set an example for everyone else. So as I give the spiel to the chiefs, is that you want to be the first one in, last person out, not the opposite, because interns and students see that, and then they say, okay, either I'm going to act like this or act like that. And so I think you want to set an example. I think I do want to show what also is the enjoyable part of our profession, which is the collegiality. I mean, there's no better profession than what we have, and that's because of the stuff that we do. And I think while working, we can have fun. I mean, it's a serious business. I don't care what we do, if it's teeth or orthodontic surgery, jaw surgery, or cancer. It's a serious business, but we can have fun. And unfortunately, we're at work, and it's going to be the case until you retire, more than you're at home. And so why not have it be fun, and enjoy it? I think the last thing would be on why we do what we do. I think we're just hardwired for it a little bit. Um, but I think in the end, it's always patient care, and I think that's what kind of drives us. I think the work-life balance is something that we're always trying to improve. many fail at it, but I think that in general, that's the drive, is just to do what's best for our patients.
Yeah, absolutely. And you talked about kind of always looking for the next thing. And I definitely agree with that. I think it's always, how do I get to that next step? And what would you say in your career is your next step? Like what's something you're really striving to achieve in your career?
There's nothing more. I mean, I'm good. I'm fine. um, I'm set. I got, for those who know me and are I'm friends with, for many reasons, it was very hard to leave my previous job in Chicago. There's a lot of reasons, and so, um, I would say to come here was it was serendipitous for a lot of reasons personally, but um, you know, one thing I didn't mention actually, and this is foolish, and I think I mentioned, going back to your questions about mentorship. And previous mentors, I think I named professional mentors, but to be honest, my number one mentor growing up was my father. And so, and that was very fortunate. I was fortunate to come back here to spend some time with him before he passed. And so, but my father was one who was the ideal worker, in that he was a firefighter. And what I took notice of him was that when he came home and he didn't complain about work, and he had things to complain about because the firehouse is a weird place and you're there for 24 hours, but he kept work at work. And I think that's very hard for us to do because we're so passionate about what we do. It's very hard not to come home and bring that stuff and internalize it. But truly, that's my greatest mentor, and I really mean that, because they teach you so much, and whether it be your mother, your father, for me, it was my grandfather, and now it's probably my uncle, who you need something outside of work. And I think also what's nice to have non-doctor mentors is that they can provide a different perspective on things, that they don't understand the technicality of things. But my father is voted by many to be the nicest person in the world. He's not like me. He's very, whatever. He's happy with what's in front of him. He was just such a easygoing guy, and people loved him for that. So that is what now, especially since he passed, I try to strive more to be as like him and have more of a balance, because he was a professional at that. So that's what drives me, I think, is to, just to circle back, is to try to demonstrate, what you should be able to do in our profession.
Yeah, and I know family is something that, that you definitely have mentioned is important to you. And it's something that I learned about you really quickly when I interviewed for my position. My mom was with me, and right away you asked if she wanted to join us for dinner. And it was just really nice I don't even know if you remember that, but it hit me
Hmm.
different because it was like, oh wow, he cares that my mom is here and he wants her to come if she wants to. And so it was just really special to be able to know that you cared about my family as well, and that that's something that you value. And speaking on family, and you mentioned already a little bit of like work-life balance. It's something that I know everyone struggles with, and it's always hard, especially when you love what you do for work, and you work so hard at it. A lot of people, I hope it's okay that I share, but a lot of people might not know that you're an avid runner and you've run a lot of marathons, and you have a lot of other
Hmm.
hobbies outside. Pizza making is one of them.
I've ran two marathons, so I wouldn't say a lot, but
That is two more
yeah.
than I have.
Yeah.
But how do you try and find that work-life balance and keep it?
Oh, I don't. I'm still striving for that. So yeah, I really came notice of the work-life balance when I was in residency, and some of the people I mentioned, and some other people who are just, I don't know if anyone's perfected it, to be very honest with you. And I've seen people who I just adore and look up to so much not perfect it. And I think it's a balance, being it's going to teeter, it's going to go back and forth. And I think so definitely I have not perfected it. That is one thing, if you ask Jess what I'm really trying to do career wise, is probably perfect that more and more. And it's a thing where if you travel for a meeting, maybe put an extra day in there to spend time with friends, your colleagues. Why not, right? We get this one go at it, make it worthwhile. I think as you said, running, I mean, I don't know, maybe it's like getting a little older. I used to, you know, be not so nice to runners, and of course now I do it myself. I thought it was very pointless to not play a sport and just run for no reason. And then even the same thing, I trained in Portland. I almost had a disdain for cyclists. They just got in my way, and now I got a road bike, and people. These are the things that you do. So I think these are healthy hobbies. I do think being fit or trying to be fit in whatever capacity that is. It goes to the gym, if you're walking, if you're running. I definitely think that makes you a better surgeon. I remember in dental school a couple of years, I took off from like working out in general, just because I'm like, there's no time, that's an hour I could have from studying. And to be very honest, I think when you add some kind of activity, whatever it is, into your day, it actually helps like organize your day a bit better. Almost like when your schedule's more full, you can organize it better. When you have some time off, you almost don't know what to do. You can procrastinate more. So I think that can help you in general. And as you know, I kind of joke with you a lot, and our former fellow David, I kind of pushed you guys into doing that a little bit, and I think it's a healthy hobby to have. So and to be honest, like now when I go somewhere in meetings, even recently, you can go running with the residents, go running with other attendings. It's kind of like a nice collegial thing to do. So it doesn't have to be running; it could be whatever. But definitely, have not perfected the work life balance, but am striving to do so.
Well, I definitely admire, I think you're very flexible too with it. And I always notice that, one of the things that I say is I have to do this amount of miles today. And sometimes you'll come in and be like, oh, well, I was supposed to do this many, but I didn't have time. So I did this many instead. And I think that's like the compromise of finding the balance. And I think you actually do it really well, maybe better than you realize. And so I'm always like, okay, I have to be better. If I can't do the 8, at least maybe I could try to do 4 miles, and that's okay.
I think it's okay. I think that's fine. Yeah,
Yeah.
absolutely.
And just to shift gears a little bit, the topic of this conversation is really regenerative medicine, and I think in craniofacial surgery as well as head and neck reconstruction, obviously regenerative medicine is really prominent, and there's a lot of advances in technology, and you do a really good job at staying involved in research, up and coming technology, new techniques. What do you want to see in the future of regenerative medicine and tissue engineering? What do you feel like would help the field? Is there something specific or just a general movement in one direction?
Yeah, I think I think our goal is to. I think we got it down. I think our especially has gotten it down where we can reconstruct mostly anything now. I always talk about this, and it's a broken record, but just 2 3 decades ago, people were left being social cripples after jaw resection, for example, and now we really forget that that's almost never happens. I mean, in fact, when we can't do a full on recon like a free flap, and we have to switch gears to something, whether it be for poor vessels or palliative or radiation, what have you. I think I really feel bad after that case. As you know, we did one recently, so that doesn't make me feel good. But I think our specialty is so good at this, and this is not a knock on anyone else, because as you know, we work with all the specialties here at our center. We're the only ones who can offer everything. So we're the only ones who can offer resection, um, reconstruction, and then full dental rehabilitation. And then if you add the neurosensory component too, that's another added bonus. So I think that's really nice. To me, the next step is to not only do this all in one step, which I mean, the brilliant protocol developed by David Hirsch and Larry Breck, and when they were in New York, and they're still doing it now. It's been taken over by so many surgeons in our specialty, and expedited. I think the whole John a Day protocol. That's just really amazing, and that's something that I offer to most patients if possible. I do think the next step, whether it be in the craniofacial realm or in the head neck realm, is to really not have a donor site anymore. So while I'm really proud of completing the fellowship and being able to do microvascular surgery, I think the next step is to tissue engineering. That's one avenue. That's one of many, I think. Can we have, like we have drug eluting stents, can we have drug eluting plates, that elude? I mean, these are things that I think are actually not far away. And people are testing out there, people who are much, much smarter than me. But, you look at the work, I think that people like James Melville is doing down in Houston, and he's taken a technique with, tissue engineering and that Dr. Marks developed, and he's really made it very reliable. And as you know, I try to push that now in our patients, and so much so that our nurses, I think when they see us doing that versus a flap, they're like, wow, you're not going to do a flap today? It's like, no, we're going to try this. And so it's a really cool thing. And I think that's where not many other specialties are doing that, maybe because it's the dentist in us, but that's a really cool thing. And I think the grafts are getting better. As you know, some of the grafts we're using now have proteins in them already, whether it be BMP and other things. So I think that's being perfected. In the cleft world, I think, can we get away from a harvest site? I mean, I think, as you know, when we do an iliac crest bone graft harvest, it's minimal morbidity, it's very quick, it's a small incision, we can get good enough bone. But can we not have a harvest site? Can we do BMP and allograft? And a lot of our good colleagues in our specialty are using that as a first option, and I think that's great. So, probably for me, I use it more in the secondary setting, or in the redo setting, or in the adult setting. If it's a kid, usually we'll still offer autogenous harvest. But I think in both the head and neck realm, the craniofacial realm, orthognathic surgery, is there something we can do in orthognathic surgery to augment our healing? Can we take that typical 6-week window we get patients to start chewing, which I know that varies? Can we shorten that? So I think that's, for me, the next realm. It's not going to be done by someone like me. It's probably more of the basic researchers who will need clinicians like us to do translational research with them and hopefully come up with some things that are going to augment patient care. And then I also think industry is just pushing the limits so much. So, for better or for worse, I think industry is just working a lot with surgeons now, and they're making products based on surgeon recommendations and our needs, and so that's pushing it too. So all those things together, I think, are really going to be the next step in, I think, regenerative medicine.
Yeah, absolutely. And I think that it really ties into what you mentioned, when you talked about what drives you, which is patient care. And I think advances in technology, anything that can improve patient care, decrease, morbidity, which is already very low, as you said, in a lot of the procedures we do. But it's like, how can we make that better? How can we, improve the type of care that we provide so that we minimize as much as possible, risks? And it's pretty incredible to see where that's going. And I loved Dr. Melville had a really great lecture, 2 years ago, I think it was at Amos. And, those are a lot of the principles that, I continue to read about. And it's something that, we've talked a lot about in fellowship, and you've applied in a lot of our cases. And so that's really cool as well to see where that might go.
Well, and yeah, and also, yeah, what James is doing is just incredible. I think, the stuff that he shows, he does it over and over again. And also, he also has published it in our recent clinics, his cookbook for doing it. So he makes it very transparent, and I've hit him up for recommendations. But I think also, this is where I think being not just doing one thing. I'm a big believer in that we have this wonderful specialty. Don't just work in a silo and do one specific procedure. I think there's something to be said for only focusing on something. I agree, and I know a lot of people disagree with me for not doing that. But also, you can then take techniques from one realm, like say craniofacial, and we do this very often, and apply it to the head neck realm, and then vice versa. You take it from the head neck realm and the reconstructive kind of area, and then you can apply that to children and in the growing child. So I think just the more of us that play in the sandbox well, and we continue to push this, will only make patient care better.
Yeah, absolutely. And, just one last formal question before we do a quick rapid fire round. Um, you've done so much training. You're very accomplished in research and, academia and surgery. There's just so much that you've done. And I know a lot of people who listen to this podcast are either residents or recent graduates. And what would be kind of your big number one advice for people who are just getting started in their career, trying to grow their career?
Yeah. I think that's a great question, and I think if you want to do extra training in any capacity, whether it be a medical degree, a fellowship, a master's, a PhD, just go do it, and go do it now because I had reason for doing that because I knew once I got out and loans build up and you get the taste of maybe a salary that's over the PGY4 level, it'll be tough to go back, right? I think that's one thing, but also one thing that actually my program director, my second one in Portland, Mark Engelstad, used to make a good point, and that he said, if you kind of people always talk about 6-year programs versus 4, or doing a fellowship or 2 versus not, or medical school, and they talk about income, for example, or time loss. When you're in your 50s or mid 50s, and you do a fellowship, or if you weren't to do a fellowship, your bank account's probably going to be the same. You probably won't notice anything. It's not like you're like, oh, I wish I didn't do that fellowship because man, I'd be rolling in the dough right now. It's like so from a financial aspect, I don't think things will be much different. And I mean, maybe I don't know, maybe I would have more money right now. I'm not sure. But there's that, and I think also from a time loss perspective, I don't know. There's no one I've ever met. It's almost like boot camp with the military who says, I don't know if you want to do it over again. Like I wouldn't want to do my first year of residency over again. But oh my God, it did teach me so much. And I think I never regretted it. So I don't know many people who did a fellowship or extra training in any realm who say, you know what, I wish I wouldn't have done that. I can't say I met someone. So I think if you're thinking about doing something, just go ahead and do it. And if you don't know how to do it, or if you don't know who to talk to, there's people like you, there's people, like me, there's other uh, people out there who are always willing to talk about things. Obviously, we're very passionate about this, so I think just go ahead and do it.
Awesome. Well, just to keep things light, I have a couple rapid fire questions for the end of this before we end it. So, what are your favorite sneakers?
Oh, well, right now, that's a great question. I probably have a set of 10 that I use for running, but probably the Vapor Flies for race day, and I just obtained finally a pair of the Nike Alpha Flies for race day.
You're
So
definitely a sneakerhead.
yeah.
What's your favorite pizza topping?
Geez, I think you gotta go with the basics,
Fair.
and then and
Favorite
then and
OR
then add
playlist.
some pepperoni, maybe.
Got to get the protein in there.
That's right.
What's your favorite OR playlist?
Um, so I use I don't know if I use one of the services now, and it's my likes, and it puts together on my likes. So because I run to like a lot of times like EDM and stuff like that, as you know, we might have like a 70s, 80s, when we're doing craniofacial with our neurosurgery team, we have some hip hop, barbecue, gangster rap. But a lot of times you'll hear it might be Elton John, and then we'll have Tupac, and then we'll have maybe some Rufus Del Sol. So it is, I think, the mix that you hear every day, Jessica.
That's very accurate. That's basically what it sounds like in the OR. You just never know what you're going to get.
Right.
What's your favorite surgical instrument?
Um, I think the number 9 periosteal.
What's your favorite procedure?
Ooh, that's always asked. You know, I mm, I don't know. I, I mean, I really like a good recon day, but if I'm a bit tired, I like a good lip or palate, cleft lip or cleft palate. So probably, honestly, if I'm hit me right now, probably cleft lip because it's always changing, and there's nothing said about it, and you have to be willing to kind of uh, change your plan to that child and what the cleft deformity is. So I would say that right now.
Awesome. And if you had to give one of these four things up, what would it be? Caffeine, bourbon, berries, or protein powder?
Um, Probably protein powder.
Oh.
No, actually, that sounds. I would say because not being able to get rid of bourbon would have some indication. So I could easily get rid of bourbon if I wanted to.
And what's your favorite place you've traveled to for a conference?
Um, It was loosely a conference, but it was more personal. Probably Vietnam. It was great. I was looking forward to going there forever. Um, as Anthony Bourdain says, it's the best street food culture in the world, and I would agree with that. So probably that was actually my first time in Asia, and I think it was pretty incredible.
That's awesome. And the last one, if you weren't a surgeon, what would you be?
Well, I always tell patients, I mean, it'd be a professional hockey player. However, I don't think my skills would allow me to do that. So that's a great question. I think probably something else in medicine. I don't know. I'd probably change gears and go to like the business world or something like that.
Sounds great. Well, Dr. Markowitz, thank you so much. This has been a lot of fun. And if you like this content, please follow Osteoscience on the Generations of Regeneration and on their other social media platforms like Instagram. And thank you again, Dr. Markowitz, once again for everything. This has been awesome, and it's always so great to learn a little bit more about the giants in our field, and you certainly are one of them. So
Thanks a lot, Jess. You're really kind. Thank you.
To learn more about Osteoscience Foundation, visit osteoscience.org or follow us on Instagram, Facebook, and LinkedIn.